PCOS is the most common cause of infertility in women and affects up to 10% of women worldwide. While it often begins during adolescence, it can show up in many different ways, which can make it tricky to diagnose. Beyond fertility, PCOS is also linked to other serious health conditions like diabetes, heart disease, sleep apnea, and more. If you're new here, I'm Dr. Esra Shermadou. I'm a board-certified family medicine physician, and in this video, I'm breaking down what PCOS is, how it's diagnosed, and most importantly, how it can be managed effectively. Polycystic ovarian syndrome, or PCOS, is characterized by an accumulation of incompletely developed follicles in the ovaries due to anovulation, and this is associated with increased ovarian androgen production. Now, let's break all that down. PCOS is more than just cysts on the ovaries. It's a hormone imbalance that also affects how your ovaries work, your metabolism, and how your body responds to insulin. Normally in ovulation, a mature egg is released from a follicle in the ovary to potentially meet sperm. With PCOS, however, the ovaries often form tiny, immature follicles that don't develop fully or release. Without ovulation, there's no egg to trigger the usual hormone shifts that lead to a period, so cycles become irregular or stop altogether. High levels of insulin and androgens like testosterone disrupt the normal hormone signals. Other key hormones that you might hear with PCOS are insulin, testosterone, luteinizing hormone or LH, and sometimes low levels of FSH or follicle stimulating hormone. Genetics, environment, and body weight can also play a role in all this too. Common signs that you might see with PCOS include irregular or missed periods, excess facial or body hair, acne, thinning hair on the scalp, fatigue and sugar cravings, trouble losing weight, especially around the belly, and difficulty getting pregnant. Some people may just have one or two symptoms, others have more, and that's okay. PCOS shows up differently in different women. To diagnose PCOS, most doctors use something called the Rotterdam criteria, where you need two of the following three criteria. Number one, irregular or skipped periods. Number two, signs of high androgens like acne or excess facial or body hair. And number three, ovaries that look a certain way on ultrasound. But you don't need cysts on your ovaries to have PCOS, and sometimes ultrasound isn't even necessary if your symptoms and lab results already paint the picture. We also need to rule out other conditions like thyroid issues, hyperlactin, or even Cushing's syndrome, which can look similar. Your doctor will likely order blood work to help diagnose PCOS and rule out other conditions. So, can you still get pregnant with PCOS? Absolutely. The main challenge with PCOS is ovulation. Those eggs don't always get released regularly. But there are safe and effective treatments to help with that, including both medication and lifestyle changes. In fact, losing just 5% of your body weight can improve chances of ovulating naturally. If you take one thing away from this video, know that small lifestyle changes can make a big difference. For those who are overweight or have obesity, weight management is a key part of PCOS. A healthy lifestyle isn't just about food and movement. It also means addressing stress, sleep, and emotional well-being. And let's be honest, sticking to changes long-term can be hard, and that's why it's important to get support when you need it. So what are things that are found to work? Number one, focusing on whole, natural foods and balanced eating, not extremes. There is no one miracle diet that works. So whether it's low carb, low fat, or Mediterranean style, it's more about reducing overall calories and improving the quality of your food. Number two, moving your body regularly. Both cardio and strength can help regulate hormones and support weight loss goals. Studies show that even modest weight loss can help improve your cycle and ovulation. But changes in things like acne or excess hair might be slow or less noticeable. So patience and realistic expectations are important. Sometimes lifestyle changes need a boost though, and that's where medications come in. Some women benefit from hormone-based treatments to help regulate their cycle and improve symptoms like acne or hair growth. Others may be prescribed medications that help improve insulin sensitivity. The right treatment depends on your symptoms and whether you're trying to get pregnant or just want to feel more balanced. What matters most is a personalized plan that works for you. PCOS doesn't just affect periods and fertility. It can raise your risk for things like type 2 diabetes, heart disease, and even certain cancers if it's not managed well. And let's talk about mental health. PCOS is linked to higher rates of anxiety and depression, and this is completely understandable. Hormonal imbalances, inflammation, and the daily stress of managing symptoms like acne, unwanted hair, or fertility struggles can all take a toll. That's why addressing mental health is just as important as balancing your hormones. So if you're struggling emotionally, it's not just in your head, and you should seek out support. If you found this video helpful and informative, be sure to like and subscribe and share this video with a friend. I'll be covering more PCOS topics in the future. Let me know what questions you have in the comments, and I'll be sure to answer them in future videos.